Hello everyone. In this video, I'm going to teach you about the breastfeeding technique. Myself, Gideani Thomas, working as a tutor in College of Nursing. In this session, I will explain you about the various positions of breastfeeding, the tips of effective breastfeeding, what are the importance of burping, and the benefits of breastfeeding. All of you know that what is breastfeeding. So it is a feeding of an infant or young children. It is directly from the female human breast via lactation rather than using the infant formula from baby bottle or container. Babies are having the sucking reflex that enable them to suck and swallow milk. Usually, the baby has to be breastfeed for the first 6 months. That is exclusive breastfeeding for the first 6 months. Can breastfeed until the age of 2. What are the various positions of breastfeeding? These are the 4 main important breastfeeding positions. That is cradle hold, cross cradle, football hold, and side lying. We will see one by one. In this picture, you can see that how the mother is giving breastfeed to the baby. This is a cradle hold position. So mother, she should be sit with the baby lengthwise across your abdomen with your elbow supporting the baby's head and the mother hand supporting the bottom, and the mother's other hand, it will support the breast. Next one is the cross cradle hold. The cross cradle hold position is similar to the cradle hold, but you are holding the baby with the opposite arm. That is the difference between the cross cradle hold and the cradle hold position. Here, it is also known as crossover or transition hold. It gives you a good view of baby's latch on and may be a good choice at first for a premature baby or baby who is having trouble in latching. So here in this picture, you can see that how the mother is holding the baby. It is a cross cradle hold position. Third one is the football hold. The mother, she should seated in a white chair or a sofa. Position baby at your side with his legs under your arm and his head near your breast. And support the baby's head by placing your finger on his neck and shoulder, and use pillow to bring baby up to the level of your nipple. This picture you can see that how the mother is feeding the baby. This is a football hold position. The next one is a sideline position. Usually the mother lies on her side, propping up her head and shoulder with pillows, and then the infant is also lying down and facing the mother. After the cesarean section, this is a good position for the mother to feed the baby and allow the new mother some rest. She can take rest and she can give breastfeed to the mother. Most mothers scared of crushing the baby. This is a sideline position. It is very clear in this picture. The mother should lie down on her side and the infant also lie down, and then the baby can suck the breast. How to breastfeed for the twins? So in this picture you can see that it's a football hold position while she is giving breastfeeding to both the child together. What are the tips for effective breastfeeding? There is some tips for effective breastfeeding. Always we have to place 2 to 3 centimeter of areola on infant's mouth, and bottom its lip out, no dimple in the cheek, and we have to hear the swallowing sound and nutritive sucking, mother will feel tugging, not the pain, and breast after softer after nursing. So burping, it is very important. It's a release of gas from the digestive tract through the mouth. At least twice during the feeding, we have to burp the baby. Once during the feeding and once when the feeding is over. And then we have to find the most comfortable position to burp the baby. And we have to gently pat the baby's back to induce burp. And we have to protect our clothing with the burping cloth. And if the baby is not burp, that is also okay. This is a COVID-19 prevention infant feeding. Everyone, they have to practice social distancing, wash hands often, avoid close contact with anyone who is coughing or sneezing. If the baby is having COVID, keep breastfeeding. Breastfeed help protect your child when they are sick. If you are thinking about weaning, consider waiting until the health emergency is over. About pumping, wash hands before touching pump or bottle parts. Follow best practices for pump cleaning. Combo feeding, maximize the amount of breast milk your child gets. Formula feeding, follow best practices for preparing formula and sterilizing equipment. Bottle feeding, limit the number of people who feed your baby. If you get sick, if you are breastfeeding, keep breastfeeding. Wash hands often, avoid spreading illness through the respiratory droplet. So this one is important during the COVID. This is an assessment of breastfeeding latch score. This is usually using in baby-friendly hospitals. Latch, that is a latch on. A for audible swallowing. T, type of nipple. C, it is comfort. H is hold positioning. According to this one, there is mark 0, 1 and 2, and we have to give the total score, and the total score, if it is 7 to 10, it is good. You can see this assessment tool in the hospitals. What are the breastfeeding health benefit for the mother? So if the mother is giving breastfeeding, it is good for the mother. Less postpartum bleeding. There is a rapid uterine involution and weight loss for the mother, decreased premenopausal breast cancer rate, decreased ovarian cancer rate, and lactational amenorrhea. So the breastfeeding, it is important for the mother and the baby. What are the health benefits for the baby? There are many health benefits for the infant. There is a lower risk of diarrhea, constipation, infection in ear, respiratory, meningitis, urinary tract like SIDS, allergic diseases, chronic digestive diseases, juvenile onset of diabetes, acute leukemia, adult obesity. The risk of this one, it is very lower because of the breastfeeding. And for the baby, the breast milk will provide an immunological protection while the infant immune system is maturing. Antimicrobial agent, anti-inflammatory agent, and immunomodulating agent. These are the health benefit for the infant. I am summarizing the topic. In this session, we seen that what all are the various positions of breastfeeding, why burping is important, what are the health benefits for the mother and baby, and the assessment tool, and COVID-19 prevention. I hope all of you understand this session. These are the bibliography for this session. Thank you everyone for watching this video.